Autism is derived from the Greek word autos, meaning self. A child with autism is frequently referred to be living in his or her own world. Autism is a lifelong neurodevelopmental disorder categorized by marked difficulties in social communication and social interaction, restricted or repetitive behavior and interest, and sensory sensitivity. Today, conditions like autism disorder and Asperger's syndrome, once diagnosed separately, are known as autism spectrum disorder, or ASD for short. ASD is described as a spectrum disorder as severity and intellectual ability differ for every child. Some lead relatively normal lives, while others need long-term specialist support. Despite the many theories, there is no definite answer. Nonetheless, research shows that different factors, including genetic and environment factors affecting a child's brain development, can cause autism. ASD is 4 times more common in boys than in girls, based on the prevalence rate of 1 in every 100 in studies overseas. Autism Resource Center in Singapore estimates that there are 50,000 individuals with ASD in Singapore's population of 5 million. So what are the early signs and symptoms of ASD? Developmental red flags that demand professional attention include not smiling or display other joyful expressions by 6 months, not exchanging sounds of facial expression by 9 months, not responding to his or her name, babbling or exchanging gesture, waving by 12 months, not speaking in words by 16 months, and not initiating meaningful two-word phrases by 24 months. Other early symptoms include the lack of pretend play, sensitivity to everyday noises like the hairdryer, and repetitive movement. How is ASD diagnosed? According to the DSM-5, an individual should present the following to be diagnosed with ASD: persistent deficits in social communications and social interaction across contexts, and restricted repetitive behavior, interests, or activities. Symptoms must be present in early development, cause significant impairment in social or other crucial areas of functioning, and are not better explained by intellectual disability or global developmental delay. What are the long-term outcomes and treatment options? To date, there is no cure for ASD, although medication can help some function better. Nonetheless, research has shown that early intervention can greatly improve the child's development. Let us look at 3 evidence-based interventions available for children with ASD, namely sensory integration training, structured teaching, and social skill training. Sensation, that is what we can see, hear, feel, smell, and taste, gives us information about the environment around us and about ourselves. It helps us understand the world and how to act on and within it. In order to make sense of all the sensations we experience, they must be integrated. Many children with ASD have sensory processing difficulties. They often experience challenges in the home, community, and school setting. This might be seen in children who have visual oversensitivities that are difficult for others to comprehend. The sense of smell is categorized as a type of oral sensory sensitivity. Many children have abnormally strong dislikes for particular tactile sensations. The muscle and joints sense message to help us move, sit, hold items, and balance. These proprioceptive systems help us keep our balance while walking. Children with vestibular hypersensitivity tend to have a low tolerance for activities that involve movement. The sense of taste can be a problem area. The identified problems are related to auditory processing, They may have difficulties interpreting auditory information that is hypersensitive to against noise. The sensory system has a tremendous and often negative impact on the behavior of children with ASD. These children frequently 1. Seems anxious, 2. Display emotional outbursts when unsuccessful, 3. Are inefficient at accomplished tasks, 4. Demonstrate poor frustration tolerance, as you can see from the drawing demonstrated. Children with ASD often display a variety of complex behaviors across academic, social and emotional, leisure, and vocational areas. Understanding that behaviors may have underlying sensory components help guide us in interpreting and planning strategies to support the child with ASD across different settings. For structured teaching, it is a social cognitive behavioral approach applied to the neuropsychological characteristic of ASD. The goals of structured teaching are to teach the individual with ASD as many skills as possible, given his developmental level, and provide an environment so he can understand the expectations and goals around him. Spaces are organized to decrease the visual and auditory stimulation that can be distracting. Areas are defined to provide clarity and order. The structured physical environment can also reduce anxiety, which has a direct impact on his behavior and ability to learn. Schedules allow for predictable environments with knowledge of what will come next. Schedules should be individualized, visual, accurate, and easy to alter should the needs arise. Work systems visually shows the student the beginning of activity to the finish. It shows what items he will complete and how he is making progress towards being finished. Visual materials provides the students with information about how to complete a task and how to use the required materials. Visual clarity draws and engages the students' attention to important and relevant information. Structured teaching is a friendly way of organizing and presenting information to individuals with ASD. Social skills training has been found to have positive effects on social skills development and behavior for children with disabilities in early childhood settings. Social skills training uses a behavioral approach applied to teach children the skills to initiate and maintain positive social relationships. Some examples of social skill training targets are 1. Friendship, teaching children to share and join in play appropriately. 2. Feelings, teaching children to be aware of their own and others' feelings. 3. Appropriate classroom behaviors, teaching children how to seek attention appropriately. 4. Conflict resolutions, teaching children how to choose positive, non-aggressive choices when faced with conflict. 5. Anger management, teaching children the techniques of staying calm in face of an anger-provoking situation. Social skills interventions are most effective when these 4 features are included: modeling, play-related activities, rehearsal, and prompting procedures. Modeling involves breaking down complex social behavior into clear and concrete steps and rules. The adult or peer model then demonstrate the behaviors clearly for the child to follow. Play-related activities involves using a variety of visual, tangible, hands-on activities like board games or phone apps to make socializations fun. Rehearsal involves practicing the target social skill in different settings with different groups of people so that the skill can be generalized. At the end of the day, we live in a social world The abilities to play, learn, interact, share space, exhibit appropriate behaviors, build relationships are important skills to navigate every day successfully.